you are tuning in to Awani Review with me, Cynthia Ng. Now, the COVID-19 pandemic is foremost a human tragedy, but if there is one silver lining arising from this pandemic, is the accelerated digital adoption in everything that we do. This is including how we buy groceries online and even to the way we work at home. Now, on the show today, we want to look at how digital adoption in healthcare has surged during the pandemic because millions of people are forced into lockdown at homes, thus driving them to the internet to consult with doctors to get their prescriptions. So joining me on the show today, I'd like to welcome Maran Virumandi. He is the co-founder and managing director of DoctorOnCall. DoctorOnCall is the largest digital health platform in Malaysia with over 1,500 specialists and GPs on its platform. Welcome, Maran, to the show.
Thank you.
Great to have you here. Now, COVID-19, as I mentioned, has severely restricted patients' ability to see the doctors in person. Can you tell us, I'd like to get a sense of how COVID-19 has changed the outlook of digital health or telemedicine?
Right. So, prior to this, we started about 4 years ago, and it's been a pretty long journey in terms of getting people to understand digital health, getting them to trust it, because it does have a huge trust element to it. But what COVID-19 did through the work that we and a couple of other digital health players did with the Ministry of Health was to really raise up the awareness. So throughout COVID-19, the initial period of COVID-19, when the Ministry of Health actually engaged with us to work with them to disseminate information and perform those telehealth, we've actually reached out to more than 5 million over members, right? And had about 2 over million members actually interact with us in a pretty intimate manner to performing their risk assessments, their consults, and getting medications delivered to them, or even referrals to their labs. So all of that has opened up the minds of the public. And I think one of the greatest outcomes of it is digital health has moved from a fringe section of healthcare to becoming part of the mainstream. And I think this dual channel of having physical as well as digital in the patient's minds, or for them to interact with their doctors or their allied health professionals, is really going to be a game changer in the way we approach healthcare in the future.
Tell us about the changes to DoctorOnCall in terms of numbers and how much have the numbers increased pre-pandemic and right now.
We had done over 50,000 articles and videos in a very easy to consume manner prior to this. And so we had a traction of about 1 million people visiting us on a monthly basis. And post COVID-19, right, the number actually peaked out at about 4 to 5 million visitors during the COVID-19 period, and now tapered down to a number that in excess of 2 million members visiting us on a monthly basis.
So DoctorOnCall was really in a prime position when the pandemic happened, when people turned on to the internet, right? How quickly did DoctorOnCall came up with a game plan to pivot to offer more services in light of the pandemic?
Well, we have a pretty aggressive team in terms of thinking creatively, and just want to narrate a story on how we were fortunate recipients when the Ministry of Health reached out to us to help them during the COVID-19 period. So we presented to them a slew of services, starting with the health information. So we created specific articles regarding COVID-19 in both Bahasa and English to address one of the biggest challenges during COVID-19, which was the misinformation, about people not having proper information about what to do, how to prevent COVID-19, what are the symptoms to it, right? And by publishing these articles and presenting it in an easy to consume manner, we managed to help the Ministry of Health and the public address their concerns, right? The second thing that we did was to come out with a risk assessment, a really smart tool that could answer, it's a quiz, a questionnaire in a short form, that could help you understand your risk, whether you are high risk or low risk, of contracting the condition, or have you contracted that? And then we work down the funnel to actually plug in the telehealth service. So this entire slew of services, about 4 to 5 of them, along with the partnership to the various labs members, were created within a period of 4 days and customized for their service. And then we kept on building it as our servers blew up with the numbers, going through the roof. And then we came out with even more customized offerings post that period.
Would you say that the pandemic has facilitated a shift in a meaningful way, in the sense that would you say that telemedicine will be a new standard of practice right now? Or would you say that the behavior of patients looking for healthcare services have reverted to what they were before the pandemic?
So I think it's a case of two tales, right? There were patients who, during the restricted movement order or period, right, simply didn't have an opportunity to talk to the doctors. And so they did what was logical, so jump on Google online and search for a way to communicate with their medical professionals. And they found DoctorOnCall and a few other digital health players too. Post that period, what we've seen is there is a high retention of that members, and it depends really on the situation, because if they had come in with upper respiratory tract infection, right, and they were actually not clear whether it was pneumonia or COVID-19 or simply a flu or fever, they would not necessarily come back to DoctorOnCall because it's not a chronic condition, it's a once-off. But for the patients who have chronic conditions such as diabetes and hypertension, or even asthma and such, right, they would see that DoctorOnCall or digital health is perfect to meet their needs of being really accessible, offering affordable services and medications, and having the medication delivered to your home. And so those patients actually keep coming back. And as their channels open, as they get on board more doctors and more providers and more insurance partners, they see it being more relevant in their life because they could actually use their insurance benefits as well as speak to their favorite doctor.
With the pandemic being the catalyst now for people to take up, online consulting, online healthcare consulting, what is needed next to drive a greater use of telehealth, telemedicine among the people?
Right.
What were the existing gaps even before the pandemic that hindered the growth of digital healthcare?
So really, healthcare is a very complex industry. It took me a while to wrap my head around, right? Being a management consultant in my past work, I actually assumed that healthcare was going to be a standard industry like FMCG or just oil and gas. But with healthcare, there's a huge amount of interdependencies, namely between the providers, being the doctors, the hospital clinics and pharmacies or medical institutions, and the payers, being folks like you and me who pay out of pocket, or the insurers, the third party, the corporates, and even the state, right? And there are various gaps in communicating. A simple example could be the fact that if you want to use your provider, like a hospital and clinic, you need to get authorization from your insurer first, right? And then you need to get the consults done, pass them the prescription, the bill, for them to make the payment, get the medication delivered to you. All of that currently is being done in a manual manner.
Right.
And what we have tried to do right from the start is build an ecosystem which allows for a lot of this communication to be done digitally or automatically. So it's akin to building a maps for healthcare. So every time you go to an ATM or you make your payments through Maybank to you or CIMB Click, you don't actually know that a whole bunch of a network and interactions and dependencies between the various parties. And we're trying to build that in digital healthcare so that all parties will benefit from it, and more importantly is no one's going to be excluded out of it, be it some small clinic or pharmacy who doesn't have the benefit of investing millions of dollars into a digital health infrastructure. So by offering this infrastructure, we would be the maps or closer to the digital reality, like a Grab of sorts, right? That will enable people to earn their income and offer and seek healthcare.
In the Malaysian context, let's take a closer look at how we are now, because I understand that we do have a blueprint for telehealth. I think it was introduced in 1997, and ever since then, there hasn't been that much development. And it is a very highly regulated space, right? So where are the gaps do you think that should be addressed immediately to really take advantage of people's interest in telemedicine at the moment?
Right. So you're right to say that it's a pretty dated act, and there's been a huge advancements in healthcare, right, or digital healthcare. We at DoctorOnCall are really pleased with the Ministry of Health, especially the DG, Dr. Noor Hisham, driving forward with the regulation. So they've come up with a group called Digital Health Malaysia Group, which and now have put forward a framework that's being run by some really great team, right? That's led by Ministry of Health, to go out there and obtain the various inputs from the participants, the corporate members, as well as the patients, to come and formulate a set of regulations around digital health, right? And this is currently underway, and the timelines are set for the paper to be published. And we, at least in DoctorOnCall, have been contributing a fair amount, because this set of regulation will try to address the participation from the providers, as well as a lot of the questions regarding the pricing and the safety and the privacy from the payer set, right? A lot of questions are still up in the air, and the responses has been very individual from the relevant digital health players, right? And there's no common standard that that could actually give room to either people with disingenuous intentions to get into the industry. So the regulation is key for us to actually band together, come together, and work for the common purpose.
I'd like to switch gears and talk about yourself.
Sure.
And DoctorOnCall. It was established in 2017. And what drove you as an ex-management consultant with no experience or in medicine? What led you to starting DoctorOnCall? What were the gaps that you saw that you think that, hey, this could be a good business opportunity?
Yeah, and when I got into a chance opportunity to get into healthcare, the first thing that struck me was how behind they were, right, in terms of the adoption of technology, and specifically digital, right? And in the conversations I had with the various parties, I could see that the inefficiencies, right, in the customer journey, the inability for patients to get accessible information or get accessible healthcare. A lot of it could be fixed by adopting what the telcos have been doing for a long time, the bankers have been doing with digital finance. I did what was only sensible. I had my co-founder, Hazwan Najib, come on board, and we started researching how the guys in US and China were doing it, right? Large countries, complex landscape, huge need with a fast aging population and huge healthcare bills, were really revolutionizing the space with digital health. So you had players like Teladoc, Doctor on Demand, American Life in the US. You have the likes of Ping An, Good Doctor, and Ali Health in China, and various other players who were doing millions of consults and interactions on a daily basis, right? And it was really pervasive. The adoption was, to the point of 10-20% pre-COVID, and obviously it's jumped on since then. So when we said, like, okay, when we saw that you could do it over there, and we have so many opportunities over here, or rather problems, right? Why not we do it ourselves, right? And bring digital health to Malaysia. So we took that approach of really doing a fair bit of research to try to customize our solutions to fix the Malaysian problems.
How do you generate revenue?
Firstly is we do provide consults and medications to the patients, and they could come either from the state, government, out of pocket, the corporates, as well as the insurers. And so that's a key driver for our revenue, and it's akin to having a physical clinic, right? But just doing it digitally and with a much wider landscape. What we also saw was an opportunity to help address the affordability issue,
Right.
which is the insurers and the corporates were besieged by healthcare costs climbing at 10 to 20% year on year. Effectively means that your healthcare bill doubles up every 5 to 6 years, right? A lot of it is driven by patients who were misinformed, very expensive healthcare bills which were unavoidable. And what we have now done is actually to offer our services to these corporates and insurance parties to actually use our service. And so now they are the major drivers for our business.
And you also work with state governments to roll out health programs, Kedah, Penang, Selangor, to name a few. Tell us about that, and how do you actually envision DoctorOnCall, say, a few years from now? You mentioned Grab as an example earlier, right? Is this going to be Grab for virtual healthcare? So what can we expect?
Right. So taking on the first question, the journey with the state governments has been a pretty interesting one. We started off by bringing our digital health solution to the state of Selangor. And we have Dr. Siti Maria, she's the ADUN for Serdang and the EXCO for healthcare. And being a doctor herself, she could really see the benefit of this, right? You could have a poor makcik in a kampung who spends half an hour to 45 minutes to get to the nearest clinic kesihatan, right? Once a month for her diabetes or heart medications, queuing up over there for an hour and coming back. The cost of taking a taxi ride of 20-30 ringgit may not mean much to us in the city, but it's a huge bill for them. And what we then said was, by us offering this service and tapping onto their Peduli Sihat program, we could actually close the gap for the people who are either living in rural areas, mobility impact, right, or just do not have people who can provide them transport, right? And she also really liked the fact that our thousands of articles which were written in Bahasa could actually address the info gap.
Right.
Because again, being the most obese country in Southeast Asia and having a lot of KPIs, so to speak, on the wrong side of things, need to be addressed by information. And so when we presented that, and we went through a pilot exercise and showed her that we were able to scale up, because the big fear is that the people who are an older set would not be, would not adopt to digital solutions easy. But we customized it. We have even had customer service members who could speak Kelantanese and to really reach out to those members and run a lot of on-the-ground campaigns. We could actually get a mass adoption. But that was also a learning opportunity for us to know how to work with the bottom 40 segment.
How do you ensure that drug frauds do not happen, and more than that, to ensure that drugs are not only genuine, but integrity is intact when it finally reaches the customers?
We saw that opportunity to allow for the separation of prescribing and dispensing, right? To keep both parties be it the doctors who are prescribing and the pharmacists who are dispensing the medications, right, as a check and balance of sorts
Right.
between each other. And the digital solution that we have created is naturally allows for that. Giving you an analogy, right? A patient calling me from Penang may get the first available doctor who's actually sitting in Miri, right, of all places. And the doctor could have a proper consult and offer a prescription, will then be fulfilled by a pharmacist or a clinic at the nearest
Penang.
point
Yeah.
in Penang, right? So that takes away the incentive for the doctor to overprescribe or underprescribe or change brands or whatever fictional idea some people may have about doctors profiteering from overprescribing or or just increasing the basket size, right? Because many people have grown accustomed to viewing clinics as shops, right? And going over there and getting unnecessary medication. That's their view, not necessarily the view that we hold, because the doctors that work with us don't subscribe to that to that view. But by us having this separation, right, we then allow for everyone to be honest and not to have any incentive. And this really has, in our analysis, has resulted in, I would refrain from using the word drug fraud, but from people practicing, negative or predatory selling behavior.
What would be technology trends within this space you think that cannot be ignored in the coming years, particularly what we're seeing with the pandemic?
It's very clear that going back to the old normal is going to be difficult for a lot of patients, right? And it's akin to kids who have gone now onto virtual learning, or a lot of us live our life on Zoom and Google Meets, right, having virtual meetings. So virtual health is definitely going to be a big component. And it's really up to us to craft how do we go about doing that, and at the pace that we want to go about doing it. A couple of opportunities that a lot of people are now very interested to focus on is for a concierge-like healthcare benefit for the purposes of people suffering from chronic conditions. So should it be acute, migraines or whatever I just mentioned to you about diabetes and hypertension, running a concierge program where you constantly have a reminder to take your medication, you have a doctor at the click of a button, right? Having your prescriptions filled in, right? Having daily tips on how you need to manage your own life, be it the stress and dietary needs and exercise needs, and then connecting that to devices which can monitor you, right? Be it thermometers or glucometers. All of that really can be done and customized at a fraction of the cost of actually having a pharmacist and a doctor sitting beside you and watching a nasi lemak that you eat and saying naughty boy, right? All of that can be done in a really fast, accessible and affordable manner, right? That's the first bit, and I think that's going to go a long way in addressing our twin diabetes and hypertension epidemic, right? That's, the numbers are staggering, right? 6 million over people with hypertension, right? And 15 or 16% of the population with diabetes. And the numbers are just climbing up at a very rapid pace, driven by our aging population and our lifestyle. And if we still stick our heads in the sand and say it's going to be just like that, we can't live without our teh tarik's and roti canai, and instead take a more advanced approach to things, we're going to get out of that epidemic, which everyone has conveniently forgotten because of the pandemic that we are in, right? That's going to be a really game changer for the people who have to pay for it, be the insurers and the corporates. And if I can just also talk about opportunities for the medical tourism sector. The MHTC CEO came on record saying that the general industry consensus is that the industry is going to drop by up to 75% right? And that's a $2 billion ringgit industry in Malaysia. So what we have are the ingredients of actually revamping the way we look at medical tourism. We have a relatively safe environment over here, in the fact that the outside view of Malaysia is that we've gone past COVID-19, right? Having 9 or 10 cases a day is really a safe estimate for them, right? But also we have the key ingredients, which are really great doctors and really a great healthcare infrastructure. But if we couple that with medical digital health, that will allow for the Middle Easterners or the Chinese or the Indonesians to safely communicate with their doctors, come in here, upload their records, right? We'll be able to turn a disaster, economic disaster, to a real economic recovery.
Okay. Now, last but not least, just want to understand what's next for DoctorOnCall. The pandemic has driven increased adoption, right, into telemedicine. Has it fast forward your growth plans for DoctorOnCall? Has it derailed your plans?
Right. I mean, unlike many people out there, we've been the lucky recipients of COVID-19, right? It's really accelerated the awareness, but more importantly is the adoption of digital health. And being there at the right time, the right place, and having really great partners of the ecosystem has allowed us to come out with various new services which people are now accepting, and really onboarding thousands of corporates, insurance members, as well as retail members on board. So I think, and we're really of the view that we'll be hitting critical mass in a very short point of time.
Do you have a timeline for that?
Well, it should be within this year, as the people are onboarded and they find it that it's just not a once-off experience, but it's a consistent experience.
All right. Thank you so much, Maran, for sharing your thoughts.
Sure.
And all the best with your expansion plans.
Thank you for the opportunity.
You have been watching Awani Review with me, Cynthia Ng. Till next time, see you again.